Hi, I'm Sid Marsh, and welcome to Inside View. Today we're going to learn a heck of a lot about Medicare. And with me I have Laurel Joliff, excuse me.
Yeah, hi,
Welcome,
how are
Laurel.
you doing, Sid?
Very good.
Good to see you.
So, okay, give me your background a little bit.
Oh,
You
sure.
say you're an expert in Medicare. So,
I am. Well,
and you speak Medicare, you say.
I do.
Okay.
That's kind of a,
you have
Medicare's
an
a foreign
accent?
language. Almost, almost I do. I interpret this book with Medicare. I've been doing this for about 11 years.
You're an insurance agent?
I'm an insurance
Okay.
agent. I'm a licensed insurance agent for the state of California and a few other states, and which means I can talk to anybody in California. And I specialize in Medicare, Medicare policies, supplements, drug plans, things like that, because I think that's a huge need. There's a huge void there.
Okay.
A lot of misunderstandings, and so I literally interpret this book.
Okay, so say I'm a newbie 65-year-old. I'm actually 66, but say I'm a newbie 65-year-old,
Okay.
and I don't know anything about Medicare. I come to you. What do you do first?
Okay, so the very first thing, so oftentimes a 60-year-old or a 62-year-old will call me up and say, okay, what do I do? Now, let me get ready. And I say, absolutely nothing. It's all going to change.
Within
Call
the
me
next
when you're
5 years,
64 and a half. Yeah, so don't stress about it, don't worry about it, but call me when you're 64 and a half. And so then I go over, when they're 64 and a half, and they do call me, I go over the junk mail they're going to get, when they're going to receive their Medicare card, if they're going to receive their Medicare card automatically. Some do, some don't, and the differences between them. And then we start planning. If they are working and they have an employer plan, we talk about how to transition from the employer plan to Medicare. If they're not working anymore, we talk about transition between Covered California, perhaps, and Medicare. And so every situation is different because it depends on what they have first and what we're going to go into when they're 65. But we talk about it.
You mentioned some people get a card and some people don't.
They do.
What's the difference
Well,
on that? I got a card, and then a little bit later, all of a sudden, I got a new card because
Yes.
they had my Social Security number on it.
Correct. So that changed in 2019. So automatically, if someone's already drawing Social Security, they're in the system when they turn 65, 3-4 months before, they're going to get a new Medicare card with their personal Medicare number, not your social anymore, but a Medicare number made up of numbers and letters. And that'll start the first day of the month that they turn 65, unless their birthday's on the 1st, and then it'll be the month prior on the 1st. But regardless, so those people would get the card automatically. You also almost always get it automatically if you have been an employee most of your life versus an employer. So I, for example, am an employer, and so I pay my taxes quarterly and a little differently than from a major employer would do for me. And so I kind of sometimes have to nudge Social Security, nudge the system to let them know that I'm turning 65 soon. And so that's kind of the differences. Sometimes we got to enroll because Medicare always says you have to enroll in Medicare Part B, but that's not always the case. Sometimes you get it automatically.
No, you don't. You get it automatically. You don't have to enroll or that sort of thing? Or?
Correct. So if someone is, let's say someone is working full-time and they have an employer plan, and let's say it's free. Well, they don't have to enroll in Part B when they're eligible when they turn 65 because they have credible coverage by the government standards.
I see.
And so you don't have to pay that $144.60 a month for the Part B if you don't need it.
And that person
wouldn't need
they were taking
it.
that out of my Social Security.
Correct.
Right, that's how they did
Correct.
that.
And if someone isn't drawing Social Security yet, they'll take it out of your bank account.
Okay.
With, of course, your permission, but.
Now you can enroll on your birthday month. Is that correct?
You can enroll up to 6 months prior. It wouldn't start until the first day of the
I
month
see.
that you turn 65.
Okay. And how often can you change your plan?
Great question. So there are, first of all, there's 3 different kinds of plans. There's a Medicare supplement plan, which is your Medigap plans, your A, B, C, D, F, G, K, L, M, and N.
What are the differences? I've always
Lots of differences.
The alphabet soup.
Yeah,
Can
that's
you
the
explain
alphabet.
that a little bit?
That's what they call it. So I'll go there in a sec. So there's the supplement plans. Then you have the Part D plans, the drug plans. Currently, there's 32 different ones to choose from. Or there are Medicare Advantage plans, which are not available in Calaveras and Tuolumne. There's a couple in parts of Amador County. So There's the
Well, it
new
depends on the county, not the state.
Depends on the county, so it depends on where you live. And so when you ask, when can I change it, to go back to your first
Right.
question, is they're all different. You can change your Medicare Advantage plan or your drug plan once a year, between October 15th and December 7th. And it wouldn't start until January 1st, that change. That's for those. The Medicare Supplement plan, you can try to change it anytime you want. However, you're going to be underwritten, which means the company can say no. If you're ill, or if you're taking some medications that they're not crazy about because it implies that you're ill or you're a liability, they can say no.
Right, with the pre-existing
So
condition.
pre-existing
Right.
does matter when one is 65 and older, unless it's, we also have something called the California birthday rule. So that is, you can change to an equal or lesser plan with no underwriting right around your birthday. So if your birthday's in May, I say, call me a month before your birthday. So you call me in April and you say, let's go shopping. So if you have an F plan, a supplement, we can go shopping and we'll find out all the different companies, because that's what I'm a broker, and so I take care of all of the different companies that I choose to. And we look at the prices of all the different F plans based on your zip code and your age. And you can change to an equal or lesser plan with no underwriting right around your birthday. It's a California birthday rule, which means it's not available in other states.
Wow.
Yeah.
Well, okay, take us through the alphabet soup.
Okay, so let's talk alphabet
And
soup.
it goes A to H or something like
Well,
that.
not exactly. A, B, D, I can't talk now. A, B, C, D, F, G, K, L, M, and N. Okay, there's a couple
Holes
skips there.
yeah.
Yes, a couple holes.
So A is just
Well,
that's
there's a
the
few
biggest thing.
plans that all of the companies are required to offer. A and F is one. But F is going away, and we'll talk about that in a sec.
But A is the general coverage.
A is kind of general. Well, there's Part A and Part B that are
Right.
Medicare. Has nothing to do with Plan A and Plan B. There's totally different.
So there's part and plan.
Part and plan. A lot of people get that confused. So the Part A and B for Medicare, let me just go over that real quickly. So Part A is hospitals and a few other things. And most of the time it costs you $0 per month. And Part B is doctors and a few other things. And that, for most people, is $144.60 a month. If you make more than a certain amount, you pay the acronym is IRMA, you pay more for your Part B, okay, for those, based on your income 2 years ago. It's silly, but that's how it is.
I'm glad there's experts like you. on this
Yeah,
whole thing.
yeah, there's not many of us, but there are a few of us. So the F plan, F as in Frank, is the most comprehensive plan you can get.
Now what happened to C, D,
Well,
E?
they
They
don't
exist?
go in order. They're
Oh,
not chronological. They
okay.
don't, this is better than this, better than this. It doesn't do that.
But are there those plans? I mean, do they exist?
Well,
C?
an F is the most comprehensive plan you get.
Okay.
If you have an F, 100% of what Medicare doesn't cover is paid. So you can have a triple bypass there in the hospital for 3 weeks. As long as it's approved by Medicare, Medicare covers 80%. Your F plan covers the other. Doesn't matter if it's AARP, Anthem Blue Cross, Blue Shield, Humana, Health Net, doesn't matter. An F is an F is an F. The federal government decides, I'm going based on this book here that people get every year. The federal government decides what an F contains,
Okay.
the benefits. The company, the AARP, Blue Cross, Blue Shield, Health Net, determine the customer service level as well as the price. So that's why during your birthday time frame, it's wise to shop, because an F is an F is an F. Okay, so it's exactly the same. Some companies are now offering little perks that are not controlled by Medicare, like Blue Shield offers an F extra. And so that includes some vision and some hearing aid benefits, and also a couple other little things. Health Net also offers something similar. And Anthem Blue Cross offers some. Blue Shield, Blue Cross, and Health Net offer the little extra thing.
Does anybody offer dental?
No one offers dental for a supplement. If you are in the valley, Stanislaus or San Joaquin County, yes. And it's basic dental. Nothing is, there are some comprehensive dental, but then you're limited to your choice of dentists. And so I may not recommend those, but nonetheless, the supplements do not. They don't offer any vision unless it's medically related. If it's macular degeneration or cataracts or something like that, that's medical. So Medicare is going to pay 80%. Your F is going to cover the other 20%. So you're going to pay nothing if you have cataract surgery or something like that. You'll also be able to get a free pair of glasses because your vision will change after you've had cataract surgery. And so that's covered. But I'm getting old and I can't see very well. Those visits are not covered by any supplements. Unless you have one of those extra plans.
Cataracts, macular.
Yeah,
Okay.
yeah, that's your medical, if it's medically related.
So when you approach 65, you have to think the government's going to pay for the plan, Part A.
Basically,
you're going to
yes.
pay for Part B.
Correct.
You're
part
going
of
to
it,
pay for Part F.
Plan F, if
Plan
you
F.
choose.
And then there's the drug plan.
There's a drug plan.
So there's three things that you're going to have to pay for.
Correct.
And the government will take care of the first part.
Correct, for the
Okay.
most part, yes. I mean, there's exceptions to every rule. The Part B, the 14460 for the Part B, and that is correct, so it covers 80%. There's also deductibles, though. The supplement is optional. People do not have to have a supplement. They can pay the 20% or the deductibles, and they'll be okay.
supplement is F that we're talking
The supplement would be F, yeah. So they don't have to get a supplement. That's an optional thing. The Part D, however, it's a voluntary plan that you're penalized if you don't have.
A voluntary plan
It's
that
a
you're
voluntary
penalized.
plan
Okay.
that you're penalized if you don't have.
And
So
what
it's
is the penalty?
very important. Oh, okay, so you asked that. You had to ask. No, I'm teasing. It's a good question. The penalty is 1% of the national average of a drug plan times the number of months you could have had it but didn't. What on earth did I just say?
Roughly, what would that come out to?
Depends on how long you didn't have it.
Okay.
So for example, I just talked to a gal today. She forgot to pay her drug plan this last year, a couple months. Well, they disenrolled her. She can't get a new drug plan now. She has to wait until October 15th, and it won't be active until the following January 1st.
So she'll be
She
penalized
will have
then.
gone 15 months without a drug plan, all of 2020 and 3 months of 19. So you're going to take that 15 months and multiply it by about $4. Let's call it $4, just because my calculator's, in my
That's
brain is
fine.
not quite working. And so if you take $4 and multiply it by 15 months, okay, so that's 40 and so $60.
$60, right?
It doesn't sound right. $4. Okay, so anyway, so it's 15 months times. So that's why 1% is about 40 cents. That's what the difference
that's
was.
it.
So she'll pay in 21 when she gets a plan about $4 or $6, excuse me, more every month for her drug plan, and she'll pay that $6 penalty every month for the rest of her life.
Oh, so you're
That's
penalized.
the penalty. It's huge.
Oh,
Sounds
so you
very
want to
little.
have a drug
Yeah,
plan.
yeah.
You don't want
Yeah, and so if you forget to pay that drug plan, you make every effort in the world to get it paid.
And so what's the voluntary part? You said it's a voluntary.
It's a voluntary, but you don't have to get it.
You don't have to get it,
You don't
but
have to have it.
you suffer the consequences.
Right. Now, if you have veterans benefits that cover 100% of credible drugs, then you don't have to have it and you're not penalized. It's very hard to get a letter from the VA saying that you're not eligible for a penalty. If one has Medi-Cal, they're not eligible for the penalty.
Okay.
Okay. Yeah, if you have credible coverage. If someone says, I don't take drugs, I don't believe in taking drugs, I'm not going to pay it. They don't have to. It's my job to make sure they know about the penalty.
So once you pay all these fees, the drug plan, the plan F, all that, are you covered for everything for catastrophic illnesses, that sort of thing? Or do you need to have another supplement of any
Great
sort?
question. So if you have that F plan, F is the easiest to explain because it's literally 100% coverage. As long as Medicare approves your procedure that you just had, whether or not it's an MRI or a 3-month hospital stay, Medicare has to approve it. Medicare pays the 80%, your supplement pays the full 20%. You pay nothing. So it's huge. Now, there are not drugs included in that, so that's
Right.
why we have a Part D. Most Part D plans have copays. Okay, and so there are limits to that as well. If a drug is doctor administered, physician administered, it's under Part B as in boy. So for example, if someone has chemo treatment
Right.
in a facility, that's under Part B as in boy. So your Part D is not affected by that. So that's a big deal when someone is trying to figure out whether or not I can afford to do this chemo.
Yeah,
It's
'cause
under
I've
Part
heard-
B.
I've heard of people with cancer that have, tens of thousands of dollars worth of drugs they have to take, and what would that be covered under their drug
It
policy?
depends.
Or
It
under
depends on
their-
who administers it.
I
So,
see.
so first of all, so a major cancer patient would most likely have most things done by the physician. And so most of it's going to be under Part B as in boy, 100% coverage if they have the F. If they don't, they're liable for that 20% copay. Okay? If they have a drug plan, and you have limits, and so there's a catastrophic limit of about $6,300. Once they reach that, they're going to pay a catastrophic fee, which is like under $5 or so for their drug plan. So I'm of the firm belief that someone's not going to pay more than $6,500 or so for their Part D drugs in any given year because they have a catastrophic limit. There's a coverage gap that covers that after that point. So sometimes people say, I spent $10,000. They don't.
They don't.
Not if it's a Part D and not if it's over $6,800 or $6,500. They've met their caps. Now they're paying the catastrophic coverage, which is like $5. Now, if something's not covered by that Part D plan, that's different. So then we might need to find something that is. And whereas Part B, if you have that Plan F that pays the other 20%, you don't have any copays if it's listed under Part B, if it's physician administered.
So that's a big deal when
a
it
big
comes
deal.
to drugs.
It's a big deal.
Where it's
Now,
coming
people
from.
don't think about that because they think drug plan is going to take care of the drugs. Yeah,
It's who says to
correct.
take the drug.
Correct, yeah.
Okay, whether it's the doctor or,
Well, a doctor's going to prescribe it regardless, but
Right.
sometimes a doctor will administer that drug. If you take it in the doctor's office,
oh, I see.
that's your
the difference.
physician administered.
It has to be given to you by the physician.
Correct.
If you go to a pharmacy and take a drug that way,
Yeah.
then it's under.
That's under Part D.
That's under
Correct.
Part D.
Correct.
Okay.
Yeah, I know, it's ridiculously confusing. And so I get calls every day from people that don't understand what's going on. And so I kind of lay it out. It's like, okay, we're going to take care of this one at a time. And so and
Has
we
the
do.
government ever thought about, streamlining this somehow, or?
They probably think it is streamlined, believe it or
I
not.
mean,
It's crazy.
because you're not part of the government. You're an
Right?
independent.
That is correct. I'm so
contractor.
glad you mentioned that. Yes, I'm an independent agent. I do not work for Medicare. I don't work
Right.
for the state of California. Yeah.
But yet they've created this market where there has to be people like you
Yeah.
to explain to people like me.
Correct,
to
correct.
do.
Well, I mean, just like Covered California, they expect people to just go online and get it themselves and understand it. And they say, they've knocked down the level of understanding to a lower level. Covered California is still ridiculous. It's still hard to understand. I take care of that as well for folks. But it's just as confusing. And then throw in the senior, sometimes I forget thing. I mean, that's scary.
Oh, that's true.
Yeah.
And that does
So
happen.
I highly recommend getting someone that you trust, that you'll work with. Oftentimes when someone gets older, I now take care of, well, I don't just take care of the kids, but I make sure the kids are there at our meeting. Because I want to make sure the kids understand what mom and dad have. That's super important.
So the whole family's on the same
Absolutely.
page, right?
Yeah, so the kids know. I had a lady call me several times this last open enrollment saying, what do I have? What do I have? Because she's getting so much junk mail and she doesn't understand it and she's getting older. And so I called the son, I called the daughter and said, okay, it's time. I will not meet with mom unless you're there.
Now, can anything be done about all the junk mail that we get?
I wish.
I mean, can the
It's
government?
horrible.
I would think-
Here's a good example of that. By October 1st, every year, the drug companies have to send you what's called an annual notice of change. It tells you, okay, this is what your plan is now, this is what it'll be next year. These are the changes. This is what the rate increase will be, this is what the copay increase will be, these are the drugs we're not going to cover anymore. Well, by law, they send it. And people say, well, I didn't get it. And I know they did, but the problem is it came with 4 pieces of junk mail from the same company. And then they have other companies that are sending junk mail. So they think it's all junk mail. And it's critically important.
Every year there's always
Every year,
changes and
they
there's always
have to send them.
increases and all that
Yes,
kind of thing.
every year.
It never
For the
stays-
Part D.
Yeah, it never
Yes.
stays status quo.
Well, sometimes it does.
Yeah.
Depends on the company, depends on
But
the
they
plan.
have to keep sending
By
this.
law, they have to send it before October 1st. And they do, but most people don't see it. Comes in a big package, just like this size.
So October 1st is a big day for
a big deal,
anybody
yeah.
on
Yeah.
Medicare.
Yeah, check your mail. Yeah, don't throw everything away. You know, take your time and look through it, because it's going to tell you what you have, how much it'll be next year. Humana had a plan in 2019 that went from $29 into 2020 it went to $64. Crazy. And the reason why is literally they got rid of that plan, and so by law they can't put you automatically in a lesser plan, so they have to by law put you in a greater plan. Well, that greater plan was double the price.
By law, it has to be greater,
It
not
has to
lesser.
be, it cannot be less than. It can be equal to, but it cannot be less than. And so I literally was on the phone, and I don't call my people unless I have to because I've got too many. But I was calling them, saying, your plan is doubling in price. Pay attention. And so they
Now, are
did.
there any scams that are going on with all this? I mean, do you run across anything?
No, I really don't. Covered
It
California.
seems like there's so much
Well,
confusion.
yeah,
That, you know,
yeah,
some
you would
scam
thi-
artists
yeah.
could get
Well,
in there and
CMS, Centers for Medicare and Medicaid, are highly regulated. Our agents are highly regulated by CMS. And so that means that we are going through education every year, we're certifying, we're testing, we're doing all of that stuff. And we're also not calling a senior unless they call you. If you said, you know what, call my brother, he needs this, he's turning 65 next month. My answer is, have him call me, because I cannot by law call him.
okay, you'd be
That's
penalized.
huge.
Yeah.
Well, I could lose my license. And so that's a big deal. Stuff like that. I can't buy you a meal. I can't say, let's go to lunch. That's a no-no.
So
I can buy you a donut. I can buy you a cup of coffee, but I cannot buy you a meal.
a
And
full
yes,
meal,
that
huh?
is specified. What is a meal and what is a snack?
So there's a manual like this just to be
Kind
an
of,
agent
yeah.
almost.
Yeah, it's crazy, and it changes every year. But for Covered California, so let me go there real quickly. Covered California is coveredca.com. I can be on the phone with someone and they want to know what I'm doing, so I say, okay, go on the website with me. And they'll say, okay, well, I don't see this. Well, they're on the official Covered California. I mean, they're bad agents have created websites that look like the official ones.
So that's kind of a scam. in
That is a
way.
scam.
Right.
Well, I don't know if it's a scam, but it's not official. And so I say, take it all out, coveredca.com. Now, the Medicare.gov is official. There are Medicare.com websites that are not official. Medicare.gov is the only official Medicare site. So little things like that.
You've had people?
Not too much, probably because seniors get this information, and so
They get it, but do they understand it?
well,
That's why you're in
yeah,
business.
usually not. Yeah, yeah, it's scary. It's kind of scary, kind of sad. My mom's the only one I know that reads this thing because it's so confusing, and it's, you know, half of it is, more than half of it's glossary, you know, and some of it talks about penalties, some of it, and there's a lot of, you know, you may or may not, as opposed to you will or will not. I mean, those are kind of important when you're trying to decide whether or not I want Medicare.
Now, you can not have Medicare.
You could.
I mean, if you were wealthy or whatever,
Yeah,
and didn't care,
you could.
could say, I don't need Medicare. You're not. It's not a have to case.
Correct.
But if you do Medicare, then you have to do the drug thing.
You don't have to. It's a voluntary plan.
But I know, but you're penalized.
But you're penalized, yes.
I'm going to say,
Yeah.
do you get penalized if you don't use Medicare in some way?
No, until you try to get it.
Oh,
So for
okay.
example, if you say.
After 65?
After 65, if you say, you know what, I don't want Medicare. Just send me Medicare Part A. Fine, it's zero. I'm not going to pay for it. And if at 70, let's say, I say, you know what, in fact, I have someone that's like this now. He's 70, he needs Medicare Part B. Well, he can have it, but he's going to pay a penalty for every year he didn't have it but could have. So 10% each year, so 5 years, that's 50%. So he's going to double, or in half, I should say, what he's going to pay for that Part B. But more importantly, he can only apply for it between January 1 and March 31, and he won't get it till July 1. And this guy is sick. So he's in trouble.
So
Because he chose not
regardless
to.
of what your income is, you should get Medicare just to back it up.
Yeah,
Otherwise, if you want to take it later on, you'll be penalized.
you're going to be penalized if you don't have credible coverage up until that point. And then, yes, you have to prove it. So there's a lot to talk about. When I get together with someone, I do what's called a Medicare 101.
Okay.
It's an hour, and we go over, and I have a visual that I show people, you know, if you live in this county, you can do this, this, or this, and if you live in this county, you can do this, this, or this. I say, these are all your options. I go to medicare.gov, and I show them all their options, and then they decide. I don't tell people what to do. I show them what their options are, and then they choose.
Interesting, because I thought Medicare is a federal thing, but yet it goes down to the county jurisdiction kind of.
Medicare A and B is federal.
Everything else is county-based.
Correct. Well,
Not even-
Medicare
not even-
Advantage is county. The Medicare supplements are statewide. And Part D is statewide, which is government, but
And then what are the county ones you were saying?
that's Medicare Advantage.
Advantage.
So San Joaquin County has, 18 different plans to choose from, in addition to the supplements. And some of them cost $0. But they're HMOs, and so you need to go to those doctors. So the federal government, Medicare, is paying the companies big money to take care of you. And so people go, wait a minute, it's $0. How's that possible?
Is Calaveras a good county to be in for Medicare?
That's a good question. We have a wonderful standard of
you're-
living here.
Well, yes, but I mean, there's different,
Yeah. Well, when you start driving to doctors more, you don't have as many physicians to choose from,
I see. Yeah.
and that becomes an issue. I have a good friend who has kidney failure, and so she's in Lodi three times a week, getting renal.
But are the
you know.
rules different for Calaveras than, say, Amador
No,
and all
the rules are not different. The only exception is that Medicare Advantage plan is not an option.
I have learned quite a bit today.
Probably too much.
And in fact,
Glazing over.
We are running out of time, unfortunately. But Laurel, it's been a pleasure. Thank you very much.
You are very welcome. Thank you for having me.
I'm Sid Marsh, and this is Inside View, and we'll see you next time.